Welcome to 20-Minute Health Talk, where some of the brightest minds in healthcare help us break down the latest news and developments. I'm Rob Hoyle, alongside my co-host Chris Gazewski, and today our special guest joining us back on the podcast again is Dr. Deb Salas Lopez. She is the Senior Vice President of Community Population Health for Northwell Health, and today our special guest joining us virtually is Reverend Scott Williams, who's from the Memorial Presbyterian Church in Roosevelt. This was the site of a testing center and recently a vaccination center. We're bringing health care to the communities that need it the most. How did this work out, Reverend Williams?
Well, it was a wonderful initiative. It was sponsored by the Governor's Office of Faith-Based Initiatives in conjunction with Northwell Health, and it was seamless. No trouble. No problems. We were in and out 10 to 6. It was great. And it's an initiative that we would love to continue.
Dr. Salas Lopez, why is it so important to bring these services to the communities that are underserved?
Well, we were at Memorial Presbyterian last year doing testing. So these are faith-based leaders that we have established great relationships with. And we came back. We said we would come back, and we came back with the vaccine. Reverend Williams, the leadership is fantastic to work with. They know their community. They're a trusted leader in their community. So coming back with the vaccine was seamless. And we counted on him to do the outreach and to do the education within the community to bring people in to get the vaccine.
And Reverend Williams, how was the response from the community and the surrounding communities?
Oh my goodness. It was tremendous. We had folks from all over. We expected only those 5 communities to show up. However, we had a few individuals from Bayshore and Farmingdale and Seaford. But the thing that was so great about this particular initiative was that the overwhelming majority of the folks who received their vaccine were from the 5 communities I mentioned and Dr. Salas Lopez mentioned: Roosevelt, Freeport, Baldwin, Hempstead, and Uniondale. And for that, we are grateful, because these communities are largely communities of color who have not had equitable access to this vaccine.
Reverend Williams, how has COVID impacted your community?
Well, I specifically know 25 ministers who have transitioned or passed away from COVID. My father-in-law, Eaton Coward, he passed away. Close friends passed away. I was hospitalized for 11 days in the early stage of COVID. I was hospitalized in late March to early April. So it has ravaged our community. We're dying at a rate of 3 times more than our white counterparts. We believe that this is something that is not just a want, but is a need in our communities. And that's why this is so important that our folks in the Black and Brown and Latinx community receive equal access, equitable access to this much needed vaccine.
There's a number of churches. It's also in Nassau County and in Suffolk County. And how does this keep going? And are other faith-based establishments coming and saying, hey, can we get this too, or can we get some guidance and help?
Yes. So we have established a Long Island Health Equity Task Force. That task force is made of over 85 community and faith-based leaders from Nassau and Suffolk County. And their role is to help educate and provide outreach to communities to give them the information they need to make an informed decision on whether or not to take the vaccine. And equally important is to plan and inform where this vaccine has to be prioritized. We hope to continue to do this. Of course, as I said before, it will be vaccine dependent. And don't forget, Chris, there's still a lot of misinformation out there about the vaccine.
For sure, yeah.
There's vaccine hesitancy and mistrust for rightful reasons.
Reverend Williams, have you seen any of that in your community?
Well, that's interesting. I shared last week that our community, with few exceptions, were very, very interested in having access to this resource. We've had a few individuals in the church and a few in the community that have said that they are hesitant primarily because of what has happened in years past with folks that are Black, Brown, and Latinx, the Tuskegee experiment and other experiments where Black, Brown, and Latinx folks were negatively impacted. But overall, we've had nothing but a positive reaction to the possibility of being vaccinated. And we have a waiting list now of individuals from our community and from our church who are just waiting to be vaccinated.
Yes, it was interesting. The first two churches we launched on Reverend Dr. Martin Luther King Day. And in Prayer Tabernacle in Amityville, the pews were used as observation stations. And it was very inspiring. There was something about a crisis like this and spirituality and having faith and hope that we're going to get out of this someday. And so for whatever reason, the combination of having hope injected into your arm in a faith-based location carries a lot of meaning.
Awesome. Awesome. Love it. Well, I want to say thank you so much, Reverend Scott Williams, for joining us here on 20-Minute Health Talk. Dr. Deb Salas Lopez, thank you so much as always. And for everybody who tuned in, thank you for listening. Thank you for watching. Have a great week and stay safe.